And just in interest of time, we are going to get started. Please share any questions you have in the chat. We'll have somebody monitoring the chat, and we'll get to those towards the end. So welcome to our webinar on changes to SNAP and its impacts on Racine community members. So the agenda today is we will be doing a welcome and more level setting of what SNAP is and who's on it, how it's impacting our community members. Then we'll go into a FoodShare policy updates and implementation timeline from the county, and then follow with employment and work requirement support through FSET. And then lastly, Travis will be sharing about understanding participants' rights under FoodShare policy changes, and then we'll end with questionings and closing. Like stated earlier, this will be recorded, so after we'll send the recording out as well as a survey for you all to take, and then you are able to share that recording with other members, other community organizations. Our sponsors today is the Johnson Foundation at Wingspread, as well as the United Way Racine County, and the Safety and Wellbeing Collaborative, which we'll talk a little bit more about, which is an initiative of the Johnson Foundation at Wingspread. My name is Alexandria Smith, and I am the program officer over here at the Johnson Foundation. So who are we? The Johnson Foundation at Wingspread is a community-centered foundation that brings people together to explore and address and advance solutions to today's most pressing challenges. And within our strategic initiative, we have launched the Safety and Wellbeing Collaborative. And this is a group of local residents and individuals representing over 20 organizations in Racine who are working together to improve the safety and opportunity and quality. Within this collaborative, we have 4 action teams. We have the parenting and program support, the reentry support, the job and workplace support, and access to food and groceries, which we'll talk a little bit more about.
Where does this plug in?
The Access to Groceries and Food Action Team. We know food access matters for health and daily well-being, but many in Racine don't have sufficient options. So we're exploring the following solutions. The group is working on creating a comprehensive map of food access sites across Racine to identify nutritional and access gaps. We are launching a coordination of care model of nutrition security providers to streamline services. And lastly, launch a summer food program for families, also known as Venner Beats Hunger. The action members, some of them are on this call today, so shout out to you all. We have a really great group and a really diverse group with really great background in different spaces here in Racine. So today's purpose of the webinar is to give community partners a clear understanding of the recent SNAP changes and how they may affect the people that they support. So what is SNAP exactly? To ground us, SNAP is one of the biggest support programs in the country, helping more than 42 million people buy groceries every single month. It's a federally funded program, but it's run at the state level, and it is intentionally built to expand when families fall in hard times. We saw this during COVID and the Great Recession. That meaningfully lowers hunger, reduces poverty, and improves health outcomes, and even boosts local economies because those dollars get spent right at our local grocery stores and other spaces here in the community. So when we talk about SNAP, we are talking about a program that works and works exactly when families need it the most. To bring this closer to home, let's look at Racine County. Right now, about 28,000 of our neighbors rely on SNAP. That's just for January 2026 alone. Out of this number, over 11,600 are kids and youth. So when SNAP is strengthened or weakened, families here feel it immediately. About 1 out of 7 families in Racine County use SNAP benefits. The recent SNAP changes didn't come out of nowhere. They're tied directly to a new federal budget law passed in mid-2025, which is known as the H.R. 1 budget law. Because this is a federal law, every state, including Wisconsin, has to adjust how they manage SNAP or FoodShare to stay in compliance. The federal government sets the rules, and the states administer the program. So when the rules change, states have to update their systems or risk losing funding completely. Wisconsin has made updates to FoodShare processes, to match the new national requirements. That's why you're seeing changes at the state and local level here in Racine. So the message here is that these changes are federally driven, and Wisconsin is aligning to keep benefits flowing for families. And nationally, over 21 million families relied on SNAP benefits in January 2026. These changes include revision of the exception for caregivers from under 18 to 13 or younger, removal of 3 temporary exceptions that were homeless individuals, veterans, and those aging out of foster care, addition of exceptions for Indian, Urban Indian, and California Indians. They increased the age-based exception limit to age 64, and they limited eligibility for certain legal represented immigrants, including refugees and RTB members of seeking asylum. Here's where we really start to see the impact of these policy shifts. Nationwide, the new work requirements could push 2.4 to 4 million people off of SNAP, and that's not a small administrative change. That's families losing access to groceries. In Wisconsin, about 88,000 residents now have to submit new paperwork just to prove they're working, and we know paperwork barriers alone can cause people to lose benefits even when they're eligible. So the big picture here is that there's more hoops to jump through, more families at risk of losing support, and higher administrative costs for the state. So we do have a couple people here today to help us talk through that change and how we can keep families being able to access food and groceries here in Racine County. So first, we're going to talk about this policy update, implementation guidelines, and what we're seeing at the county. And then Crystal Ellis will be able to share that. She is the Economic Support Manager for Racine County.
Good morning, everyone. Yes, my name is Crystal Ellis, and I'm the Economic Support Manager. I oversee our WKRP call center, which we are a consortium with Kenosha as well. We do food share, healthcare, childcare, elderly, blind, and disabled, and long-term care. With that being said, after the bill was passed in July of 2025, implementation of all the federal work requirements have changed and went into effect as of November 1st, 2025. Some of the implementations were the age limit went from 18 to 59 to now to 18 to 64. Additionally, they have added parents whose children at home are 14 or older will now have to meet a work requirement as well. Previously, before the bill was passed, the children were 18 and older, you had to meet the work requirement. So now anybody 14 or older, you have to meet those requirements as well. One big new policy change with the federal work requirements is if an individual loses an exemption during the certification period, which our certification period is usually 1 year, it's also called a renewal, the IM agency, which is us, cannot apply countable months to the individual's food share clock until they are screened through the interview process at application or renewal for an exemption. So basically that means we cannot add time to their clock, which is a 36-month clock. We can't add time until we actually talk to the customer and complete their application or renewal. Previously, if they didn't meet any exemptions, we would send a referral through and they would just have to go through with FSET and do those programs. But now we actually have to contact and talk to the customer. A big thing that has changed, exemptions that were eliminated are members experiencing homelessness. This does not include chronic homelessness, and I will explain what chronic homelessness is. It's an individual who are experiencing chronic homelessness are considered physically unable to work. A person is chronically homeless if they currently lack a fixed regular nighttime residence and do not expect to have a regular nighttime residence in the next 30 days, or those who have been homeless for 30 days or more. This includes people who are in temporary housing situations such as traditional living arrangements. So when a customer calls us and completes their renewal or their application, we will ask that question during the process. Hey, do you have a nighttime residence for over 30 days or more? If the customer answers they do not, then they meet that chronic homelessness. Other individuals who are no longer exempt are members who are veterans, members who are former foster care youth, including any person who is 18 to 24 years old who have previously in a foster care program when they turn 18. One other big change is a person who is receiving temporary or permanent disability benefits from the government or private source qualifies as physically or mentally unfit for work and exempt from the FoodShare work requirements. This policy is further clarified to remind that a person who's receiving temporary or permanent disability benefits from the government or private source qualifies for the unfit exemption regarding of level of payment or percentage of disabilities. So how it works, like I said, when they do their renewal or their application, we will ask those questions. Hey, are you disabled, or are you physically unable to work? The customer can then say, yes, we are. We will ask them to provide proof of this information. They can get it from a doctor, they can get it from another source, and just send that back in, and then that will make them exempt from the FSET program, which is the FoodShare Employment and Training program. How it works on our side is we do the application, we do the renewal. If they don't meet any exemptions that we listed, they have to go through the FSET program. We send over the referral. Once we send over the referral, FSET ends up contacting them to do a in-home. I apologize. I don't know why.
It's
Sorry.
that orientation.
That's my
It's
fault.
all right.
Yeah, they contact them to do a meeting to set up to meet with caseworkers in the FSET program, which you will learn more about. That is the basis of what the biggest changes have been for the exemptions for on our side. I know FSET is going to speak next about what determines what they have to do in that step, but I'm not sure we're going to do any questions for me at this time, or we're going to go to FSET and then wait to the end to go over questions.
We could do questions right now for your section just so people don't lose it. Does anyone have any questions for Crystal?
I do not, Alexandria, but thanks, Crystal, for that detailed information. That was very informative. I was on another call this morning. I think Stephanie as well was on the call with me with Hunger Task Force. And so in the chat, I put a link to everything that, from DHS to everything that Crystal has referenced there, because I know it's a lot to intake if you weren't taking notes really fast. If you click on that link, that summarizes everything that Crystal so elegantly shared with us just now.
And those are actually just some of the changes that's happened with the big beautiful bill. Mm-hmm. We still have, if you're unemployed, if you receive unemployment, you meet the exemptions, disabled, there's multiple different things. So that link that Ron sent, it tells you everything that you need to know to make you exempt from the program. I do see the question, Tina, did the eligibility amount change? What are you referring to?
And while Tina's formulating that, Alicia also has their hand up.
I do. So I am the McKinney Mental Liaison at Racine Unified School District. In regards to the 14-year-old part, and I think also goes with me, Garrett's message too. So does a 14-year-old need to provide proof that they are working and then that's how they need to, or can, as a student who's experienced homelessness, be provided with that acceptance?
So with that piece, it's not the 14-year-old has to be working, it's the parent has to work. Previously, anyone 18 or under, your parent met the exemption that they didn't have to do FSET. But now it's saying, hey, you're at the age, you have a child that's 14 and older, now you have to work or meet any other exemption. It doesn't actually have to do with the 14-year-old child itself. It's just this is their age.
Sorry, thank you for clarifying that.
Yep.
All right, Tina here. So typically with my question about the eligibility amount, you couldn't make over a certain amount of money per month in order to qualify for FoodShare. Did that eligibility amount change, or does that stay the same?
That stays the same. So that's the federal poverty limit. That actually changes every year around October. But no, that had nothing to do with like the changes to the big beautiful bill.
Okay, thank you.
Yep.
Okay, we have time for one or two more questions for Crystal.
Again, a lot of that too, team, is also in that link. I would click on that link and save that link somewhere as a resource for talking points.
Okay, thank you.
Can teen parents qualify for FoodShare?
I didn't hear the first part of that for qualifying.
Can teen parents?
Yes, they can. It matters. Every situation is different, but like, yes, if a teen parent is in home, it matters if they're in home with the parent or not. So there's different ways to go about that, but that also would be in the DHS policy handbook. But they are eligible for food share, but most likely the parent can't be in the home. They're in transitioning from like the 17-year-old to an 18-year-old. It differs for children though.
Would they have to meet the work requirements as well?
Is it a child is it a teenager with a child?
Yes.
Or nope, because they have that child and the child would be under the age of 14.
Okay, thank you.
Yep.
All right. Well, thank you, Crystal. There will be time at the end of this presentation. If there's a question that pops up, we'll have time to address that. So we will move forward. Thank you. Next, we'll be talking about employment and work requirements through Equus. And we have Liana Brumby, who is the operation manager for Equus Workforce Solutions.
Good morning, everyone. So I'll just go into some details on who we are. So Equus Workforce Solution we are contracted by the state of Wisconsin to operate the FoodShare and Employment Training Program, which is FSET. We are in Region 1, which is Racine, Kenosha, and Walworth. And I also run Region 3, which is Waukesha, Ozaukee, and Washington County. FSET is designed to help food share recipients gain meaningful employment by supporting them with supervised job searches, educational goals, and certificate-based training that leads to improved employment opportunities. This program also assists with transportation needs through bus passes and gas cards whenever we have them available. In addition, FSET offers job retention services to our participants who secure employment while enrolled in our program. So this may include work attire, continued transportation support for up to 3 months after the job begins. The state of Wisconsin requires all FSET participants to engage in their assigned activities each week. These activities can include job searching, LinkedIn learning courses, our Career Accelerate workshop, and work experience placements at designated sites. Participants may be eligible for funding toward approved certificate-based training. However, they must remain active and engaging in weekly activities and meet with their case manager on a bi-weekly or monthly basis before any training discussions or funding approvals take place. Because our program is state funded, training dollars are limited. So once our funds have been exhausted, we are unable to approve any additional training until the state releases more funding. Equus is required to demonstrate to the state of Wisconsin that participants are actively engaging in the FSET program, not only showing up just for funding or transportation assistance, but we must show that that participation is being done by our participants. So to kind of piggyback off what Crystal has stated before, we have referrals that come from the food share department. We have the people that are required to be in the program, and then we also have volunteers. Once that referral comes to our intake department, intake reaches out via phone or by mail to schedule an FSET orientation in person and or over the phone. It all depends if that participant can come and attend our orientation, which is held Monday through Thursday at 9:30 in those locations. After the orientation, they do meet with a case manager to help set up that employment plan. We have a discussion on what their goals are. We create that employment plan. We assign those FSET activities. Then we also discuss any barriers that they may have. Is it a transportation barrier? You know, if we see that there is an exemption, we try to offer those resources. We have a lot of participants right now that is looking for English as a second language courses. So we have things set up into play for that. With the new requirement of the age requirement that's coming across our desk, we are in the process of setting up work experience sites, you know, because we have a lot of participants. It's just so funny. I had a participant call this morning and he's like 63 years old. And he's like, okay, what do you guys expect me to do? You know, so we are starting to get those calls and we are preparing for them. So that's why we're setting up work experience sites at Hospitality Center, Salvation Army, and at Halo, because a lot of these participants in this age group are looking to just volunteer to maintain their benefits, which will count as a workable activity in our FSET program. After that, once we meet with those participants and they do attend their meetings, then we can talk about any education and training needs. We help with HSCD and also GED for participants. As far as training, we have a lot of training that's available for participants. Some of the major ones that we have seen that had really picked up starting last year in October was real estate training, a lot of the medical training, phlebotomy and medical assistance, and building and coding has also increased. Another training that is on the rise for us is forklift and OSHA 10, and also CDL training. That's just to name a few. But again, this is what we're doing. We're here to support any person that is coming over to our program. We have a set of supervisors in each location that helps with our case managers. In certain locations, we have anywhere from 3 to maybe 5 case managers. And right now they're running caseloads of maybe, I would say, anywhere from 80 to 116 participants on their caseload that we are servicing right now. So that's just the basics of what we do for Equus. We are here to help people become self-sufficient, to make sure that all their needs are met. So that's pretty much what I have for Equus. If anyone has any questions for me pertaining to the FSET program. Or if there isn't any, if you can think of some at the end, I would be more than happy to answer.
I don't see any questions through the chat.
Do we also still have the W-2 program?
Yes, so the W-2 program, that is through Equus. Sonia Gordon runs those programs as well. So those are, I don't know much about the W-2, but I do know the W-2 program is for people with small children in the home. And we do get referrals from W-2. So with W-2, if you have or know someone that is in the W-2 program, usually what happens is once they meet the requirements with their W-2 worker, they refer them over to FSET. Now, if it is a referral from W-2, we do not give them our activities. They already are doing employment and search activities for W-2, so we just mimic their employment plan. And then they do not have to show participation to us, but they do have to show participation to the W-2 program, because for W-2 referrals, they're just mainly coming over for training. So if the W-2 workers say, hey, I have a participant, she's completing her hours weekly, she has completed a resume workshop. If applicable, she has completed a TABE testing, because a lot of the medical fields and CDL will require TABE testing. Then they refer them over to us to fund that training for them.
We have a couple. Oh, Michelle, did you have a follow-up?
I was going to say, so how do we know who to refer to W-2 and who to refer to the Equus program?
So the referrals for Equus, they have to have an open and passing FoodShare case. So that usually goes through the FoodShare department as soon as they open up their FoodShare case. Now, we do have participants that do just walk in and bypass FoodShare sometimes. So we look up their case to make sure that their case is open and passing, and then we can do a self-referral ourselves. Now, when it comes to W-2, that would be the application process that they would have to go through to see if they qualify for W-2. And usually if they don't qualify for W-2, or if they don't qualify for FSET, we do have other programs that we do reference that they may qualify for. So we just don't turn them away. We have, other programs that can also help them if we can't.
There is a couple of questions in the chat. Is there an amount of time each participant has to complete in a month?
So if someone is coming over as a required able-bodied participant, the state of Wisconsin is stating that they have to complete 20 hours a week of participation. That totals to 80 hours a month to keep their FoodShare clock active, as Krista mentioned earlier. A volunteer is 3 hours a week. That totals to 12 hours a month of the assigned activities that we assign them.
And then we have another question, is how do individuals connect with Equus? I think you kind of covered that, but I don't know if there's like a more formal way to connect.
We have a intake line. A lot of our participants call, and that number would be 262-638-7000 that they usually call to find out about our FSET program. We also have a website that we use, which is Equus Workforce Solutions .com as well. Otherwise, we have a lot of participants that do just walk in. The good thing about it is that we're all in the same building, which makes it so easier, because with the food share department being, I'll give an example for Racine. The food share department is on the first floor and Equus is on the third floor along with W2. So usually when they're up there stopping in on the ABC room, thank God for the ladies, they always speak Equus up, and we have brochures around the building. So those are some ways that, people can get in contact with us.
Someone asked, what if an individual is enrolled in college?
As long as they have an open and passing food share case, they are allowed to come into FSET. And then if they are looking, depending on what their goal is too, sometimes we have participants where the financial aid has run out and they need a couple of classes paid for. That is something that FSET can possibly look into to help get that paid. Because one thing with FSET, we do only work with certificate programs. So if any other program is financial aid eligible, we cannot pay for those trainings unless they can provide a letter stating that their financial aid is denied, and then we have to look into it to see if we're able to pay for it. Because one thing we've learned with Gateway is that if they owe money, no matter if FSET is willing to pay, they would not accept our payment unless a payment arrangement is made by that participant for them to receive their money.
Thank you. Any other questions for Liana?
These were some good questions.
All right, thank you. So we will move forward then with our next presenter. And if there's any other questions, again, there'll be time for questions at the end. So we have understanding participant rights under the food share policy changes. Here we have Travis LaChance, who's an attorney with the Legal Action of Wisconsin. I will be pulling up some additional slides from Travis, so I'll let you take it away.
Yeah, thanks for having me. I guess I could have made these slides more colorful there. I apologize. But my name is Travis LaChance. I'm an attorney with Legal Action of Wisconsin. We provide free civil legal aid across the entire states for a variety of issues, including a lot of different public benefits, specifically food share as well. And we have 7 offices across the states, including here in Racine. So don't be afraid to reach out and bug us if an issue comes up. So I guess I'm going to talk a little bit about what rights or appeal rights do recipients or applicants have if there is some type of adverse decision. Now, these rights have not changed under HR 1, so it's more of just a refresher of what people can do if an action occurs that adversely affects them in some way. And to start, you have the right to request a fair hearing. This goes before a different agency, and that's the Division of Hearings and Appeals. And this could be for a variety of reasons. It could be, hey, I didn't receive a timely decision when I applied for benefits. It could be I was denied benefits. Or, hey, my monthly allotment is being reduced because of some change that I disagree with. Or even that, hey, my benefits are being terminated. But for any of these reasons, someone has the right to request a hearing on this issue. And we can go ahead one. Thanks. So when do you need to do that? And sorry, I throw a lot of information on slides just because I know the legal side's not always the most exciting, so I think it's easiest to have something to follow along to. So generally, if an adverse action happens to you, you can request a fair hearing within 90 days of receiving notice of that action. That is generally the deadline, except if it's a situation where you just disagree with what your monthly allotment is, how much you're getting each month. You can request a fair hearing at any time. There isn't necessarily a deadline if you believe that the monthly allotment that you're receiving is incorrect. And then I also want to say if you are being terminated or your monthly allotment is being reduced or something like that, while the appeal deadline is 90 days, you would have to file an appeal before the day your benefits are going to be reduced in order to continue benefits going pending the outcome of that appeal. And that's a little wordy, so I guess I'll give an example there. So if I receive a notice on March 1st that, hey, I'm losing my benefits at the end of March, I have until the end of May to file an appeal. March, April, May. Yeah, sorry, I counted 90 days, right? But if I file that appeal before the end of March, when my benefits are supposed to end, I can ask that my benefits be continued pending the outcome of that appeal. And I just wanted to make one other distinction as well. If someone comes to you and they say, hey, I have a food share hearing, it isn't necessarily mean it's a fair hearing for one of those reasons. There's also this thing called administrative disqualification hearings. And what these are, if someone ever comes to you with one of these notices, is if the agency believes that the recipient committed what's called an IPV or an intentional program violation, the agency itself has to be the one to request a hearing and send out notice to the recipients. So if they believe that, hey, you committed fraud or you intentionally withheld information or something like that, and we want to impose some penalty, they have to be the ones to request a hearing and then send notice to you. And then they send you all the information on why they think that. And if you ever see someone with one of these notices, tell them no matter what, always go to the hearing. Legally speaking, it's really hard to prove intent. And to be honest, public benefits are not easy to get and maintain in Wisconsin. It's a complicated process. There's a lot of rules. So always go to these hearings if that's the case. But the next one, and I just wanted to send an example of if what these administrative disqualification hearing notices look like. They'll get something like this if the department believes that, hey, this recipient committed an intentional program violation. There is no, for civil law, which this falls under, there is no right to an attorney. But if someone is appealing, you have Legal Action of Wisconsin. Send them to us, and we would be more than happy to follow up with them to answer the question. The next one. So back to the more basic ones. Say, hey, there's a change. I disagree whether or not I'm subject to these work requirements, something like that. I received a notice that my benefits are being terminated, and I want to contest that decision. You can do that a couple different ways. You can fill out a form called a request for fair hearing, and send it to DHA. You can just write a letter. It doesn't have to be using that form and send it to DHA. Or you can make a verbal request. It does not have to be in writing. You can call the consortium, the agency, and say, hey, I want to appeal this, or I want to request a fair hearing. And by law, that agency worker is required to complete the form for you and send it in to the Division of Hearings and Appeals. So if you ever get pushback on agency workers, come to us. They are required to do that. So we're more than happy to help make sure they do. And if you're doing these forms yourself, you can send it to the agency or the DHA by mail. You can fax it to them, or you can send it in an email. They try to make this as accessible as possible. And then the last one is, oh, sorry, yeah, that's fine there. But if you do choose to continue your benefits pending the outcome of the appeal, it's important to know that you may have to pay back those if you end up being unsuccessful. So it's a risk assessment that you got to consider when the appeal is pending. If, hey, do I really think I'm going to win? Or, hey, is this kind of a toss-up and I don't want to risk having to pay those benefits back? Next one. And this is the form. This is that DHA 28's request for fair hearing. Check the box for FoodShare. You can check if it's a denial. application is not being processed timely, or my benefits are ending, or there's an overpayment, or my amounts reduced. It's kind of just a check the box, give your information, sign dates, and make sure it's sent to the proper individuals. And then last one. And then after you make this request, within a couple weeks, you'll receive a hearing notice. This is what that looks like. They usually give you about a month's heads up that, hey, there's going to be this hearing, which is done by telephone. It's an administrative law judge, which the state usually calls the recipient, calls the agency worker, gets both sides of things, and issues a written decision after the fact. And I will say, when someone requests a fair hearing, more often than not, it prompts a pretty quick response from the department. Usually, if I submit this request within a week, I'll get a call directly from someone saying, hey, how can we resolve this? And more often than not, things are able to be resolved before a hearing actually takes place. So that is all I have on the process. I do see the question here. So in general, I mean, I guess I don't know if you're talking about charges in the way of an intentional program violation, or if you're talking about charges in the way of criminal. I mean, what you're saying there doesn't seem to rise to criminal. I mean, technically, yes, public assistance fraud can be a actual crime. The only time I've ever personally seen it is someone actually physically selling a Quest card for cash. It very rarely are there actual criminal charges that result from FoodShare alleged fraud or something like that. Um, I guess, are you just asking what they are not allowed to buy with their benefits? Sorry.
I've just seen like two different articles about women that have used their SNAP to purchase the groceries and then like spent their time making like baked goods and like selling them and then had to go through court hearings about it. Because I was under the impression that like if you had SNAP, you couldn't like, you know how people are like, I got so many amount of snaps and you can sell them. Like I remember that being a thing growing up. And I know that that's illegal. And so like when I saw that people were actually like going to court over like selling things that they made and they like put their time and effort into, I was like, wow, that's wild. And so I guess I wasn't sure like if that's a common occurrence or not, or if there are other, just things that I might need to coach some of my clients through, like this is not something you should be doing, or you should be okay if you do this sort of thing.
I've never heard of that before in being brought up in an IPV or even progressing to a criminal situation here in Wisconsin. Um, so that's not something I'm aware of personally, that exact fact pattern being an issue here. I don't know if any of the other presenters perhaps know more about that, but at least that's not a fact pattern that I'm aware of ever being brought up in an IPV here.
We do have another question. Are FSET staff trained or required to assist recipients to file for a fair hearing?
Yes, we all are. We have the forms there, and we assist them to file the paperwork, and then they can go ahead and file that paperwork.
Any other questions for Travis or Filiana or Crystal? Anything that would help you and the clients that you serve, the community that you work with as we navigate these changes?
I mean, I will add though, I think, was it Kyra who was asking about the lady buying the the food or the snacks to sell for baked goods. I did see that as well, but I don't think that was more towards us. I do see that, and Crystal can speak on this as well, where they are trying to get a little bit more strict on how you do spend your food share, where they are trying to stop from buying like candy, snacks, and things like that. It hasn't come across FSET desk, but we did have a talk about it the other day in a DHS meeting. So just keep tuned to those changes. I do believe that's probably going to end up happening.
Yeah, there is pending legislation about that exact issue. You're right. So stay tuned.
Crystal, I saw you came off mute.
Yeah, that actually was passed for Wisconsin last week. I believe for the snacks that you cannot buy. For the baked goods, I think every state is different on the policies they have to follow. We have not had that here. The biggest thing we're dealing with for program integrity, such as fraud, is skimming, going into different businesses and having your card taken off skimming devices. That's what we're dealing with here. But I have not heard anything about the baked goods in Wisconsin, but I'm not saying it does not happen. We just haven't prosecuted anyone on that yet.
Bob, I see you have your hand up.
Yeah, I think probably this is for Crystal. Could you talk a little bit about how somebody would get a notification that they are either their benefits are going to be ending or they need to be worried about ending? Both like how they would get that notification and when they should be paying attention to whether or not their benefit is going to end.
So it's based off how the customer wants it. We always mail out information, but some customers like their stuff emailed to them. So you can, when you're doing your interview for your renewal or your application, you say, hey, I would prefer my stuff be emailed. We'd send it that way. They could also always go on Access. It's access.wi.gov and receive their information there. That'll tell them the most, even if you get it mailed out or emailed, that would give them the most information.
And a little description of it. It's often this 7 or 8 page letter. It'll be about your benefits coming from the local consortium. And it will say, hey, your benefits are changing. And then it usually will, give a description, benefit, food share. This benefit is ending effective this date. And then you have to flip through a couple pages to see exactly the reason why. So if you get any of those about your benefits letters, read them. And if you don't understand them, don't just ignore it. You can call us, talk to your consortium if you need an explanation, because I recognize we get a lot of people who come to us and say, hey, I have this letter and I don't understand it. That's perfectly fine. They're long letters, and I understand there's a lot of information in there sometimes. And if you need someone to look it over and talk it through with you, please feel free to reach out. Don't be afraid to, don't just ignore them. I guess that's kind of the moral there. So. And to answer the question, it depends. We don't have a lot of people and we cover a lot of counties. So at minimum, we'll be able to, help people request fair hearings if that's what they need, and talk them through it, give them information. It does not guarantee that we'll have someone available with the time or availability that can actually be present at a hearing. But potentially, it just depends on the specific advocate that it comes to and their resources at that time. So.
I know Jessica with United Way. I'm curious if you just want to talk a little bit about 211, the interactive food map, and then the hotline.
Sure. So 211 is a free 24/7 confidential resource referral hotline. You can physically call on a phone, or if the idea of talking to a human being on the phone is horrible, you can text. There is an online chat feature. And there's an interactive map, and the resources that are listed and available on 211 are vetted. So it's not just anybody can put just anything into the database. And the vast majority, well over 90% of the resources are reviewed on at least an annual basis. So it is the most kind of current up-to-date place to send people to get lots of information about lots of different things, not just food access, but really any kind of need that they are experiencing. to get consistent information and referral to resources. United Way receives data from Impact 211 about what the call requests are. So we can see not only who's calling about what, and when I say who, I mean geographically by zip code, not a person's name or anything, but we're able to see what are those top needs that are being asked for, what are the trends year over year and month over month, but also what are the unmet needs, where are people calling and there's either not a resource that exists or they weren't, the person answering was not able to connect the caller to a specific resource, maybe because it had already been expended for the year or they didn't qualify or whatever the case may be. So that data is really helpful for people to also have a sense of what's happening. I think it is in some ways an early predictor of what, where we're going to see future needs pop up.
Thank you, Jessica. Any
And
questions? Oh, yeah.
I had one more thing to add as we, Leona had brought up about the food and the candy. So the state assembly passed the substitute amendment for it to have a waiver to restrict use of food share benefits for candy and soft drinks. So now the next step, it has to be approved by the Senate.
Thank you. Any other questions for the presenters, for Jessica regarding 211, about food share and SNAP?
And I also did include our website for Equus, where you can go and learn more about us, ask questions, and also participants can actually go to that website to have someone reach out to them for a self-referral so we can set up a phone appointment to have them enrolled over the phone.
Thank you. I am not hearing any further questions. I just want to thank everyone for their time today. As stated in the beginning, this will be recorded and sent out, so you guys will have information if you want to go back, take notes, or send to any other community provider. Thank you so much for your time today, for your week. We'll send out notes, we'll send out links, and everything that is important. So thank you all. Thank you to the Food Access Action Team, and then to our presenters today. Thank you.